Yeah. So, hello everyone. This is Dr. Vivek Goel. I hope I am clearly visible and audible. If yes, please give me a thumbs up so that I can continue with this medical group nephrology orientation session for the super specialty entrance exam 2022. Am I clearly audible and clearly visible to all the viewers out there? Yeah, so I'm just waiting for a confirmation. Yeah. So, a very good evening to all of you. I hope you all are in very good health. This is Dr. Vivek Goel, your nephrology faculty at Doc Tutorials. At the very outset, I would like to thank each one of you for having taken out the time to join this session. So, this is a very, very special and the need of the hour because, recently we have just gotten over with the NEET SS results of 2021 and we have done amazingly well. Okay, we will talk about that later. But another breaking news that the NBE has crashed upon us that the next NEET super specialty entrance exam is just a few months away. So it was announced in January that it is scheduled on the 18th and 19th of June 2022. So you do not have even a year for a preparation. You even have less than 5 months to go now. So the one thing you cannot afford to do is procrastination. You need to be on your toes and you need to be, get up for the preparation because you always have the early movers advantage, as I always say. So we at Doc Tutorials are there to help you. And that is why we have planned an orientation session because very often we get messages from students, we get mails from students stating that, sir, we have absolutely lost our way, we do not know how to begin with, we do not know how to proceed, we are just reading randomly. Okay, so the mission is NEET SS 2022, which is on the 18th of June 2022. So are you ready? Are you ready to rock and roll? If you aren't, this is the session that should pump you up and take you further in this journey to conquer this exam. At the very outset, I would like to tell you that our students have done amazingly well. The year 21, the NEET SS 2021, it showed amazing results. In fact, for because that it was a subject wise exam in the NEET SS 2021. First of all, you've already been well aware of the pattern by Dr. Rahul Rajiv in his orientation session. So I'm not going to repeat the entire thing, but I'm just going to repeat it in brief. So you know that the NEET SS 2021 was a super specialty based entrance exam where 60% of the questions were asked from the super specialty you opted for. And that is why all the students who were preparing for nephrology were very closely associated with me. And you will be very, very happy to know that more than 75% of our nephrology students who studied with me, and I say with me and not from me and by me because they were actually, I was studying literally with them because I was trying to be present with them at each and every step. They have done wonderfully well and we have got more than 75% strike rate. More than 75% of the students who were there in nephrology with Doc Tutorials, with me, with us, have cleared the exam in the very first attempt. So this has been the wonderful stature of the performance of our students at Doc Tutorials. So first and foremost, just a brief about the pattern of 2022. As the notification by the NBE stated that the NEET SS 2022 is going to be conducted on the 18th of June this year. So we are already in the mid of February. You only have 4 months to go for the exam. But please remember the central institutes, that is the AIMS, the PGI Chandigarh, the JIPMER Puducherry, the NIMHANS Bengaluru, and the Sri Chitra Thiruvananthapuram are not a part of the NEET SS, and they form a separate exam which I will talk about later, which is the Institute of National Importance Super Speciality, or so to say the INISS exam. So that requires a special skill set, a different mode of preparation, which I will be talking about today in brief and henceforth in a new session in great details. Coming to the NEET SS 2022, you all know that the NEET SS 2021 also was scheduled to be of this pattern, but at a very sudden notice. And due to the court case, they reverted themselves back to the old fashion of 60 and 40. But now, henceforth, from 2022, you shall have a medicine-based exam for your NEET super specialty entrance medical group. By that I mean, you no longer have the demarcation of 60% from the super specialty and 40% from the broad specialty. That is no longer there. All the 100% questions will be of the exit level of your MD and DNB general medicine. So to say, they will be of the entire medicine, and they will not be of from one particular subject specifically. Now you will have 150 questions in this exam, and you have 2 hours 30 minutes, that is 150 minutes to take this exam. So to say, you have a minute for one question. Now you have to keep this thing very importantly in mind, is that the pattern of the question is rapidly changing. Gone are those days when you were having orthodox, taken from those old question banks, those one liners. What is the most common cause of dash? What is the drug of choice of dash? No. Now what you have is an integrated and clinical vignette approach. So you have long stem questions these days. Very many students even complained and told me that, sir, very many questions of nephrology were quite long, and they just took more than 30 seconds to just read the question. So that is the stature of this exam now. So you know that you are going to have 150 questions in toto. Now dividing, there are, of course, medicine comprises of all the specialties that you know of. Now I will be talking about nephrology in particular. You have been guided for the medicine in toto already by Dr. Rahul Rajiv. Cardiology orientation session has already been taken wonderfully by Dr. Kamal Sharma sir. And so now I will be talking about nephrology. Now when I talk about nephrology, it comprises a major chunk of internal medicine, so to say, in every portion, every exam of internal medicine. Why? Because I so often tell you that nephrology is perhaps that specialty which is the closest to internal medicine. Because when you study nephrological diseases, when you study glomerular diseases, it is almost very close to internal medicine. And so that is why nephrology is very important. And what I am preempting is, out of those 150, at least 25 to 30 questions will be from nephrology or related topics. This is very important. Now, what is the type of question that you should be expecting in the NEET SS 2022? The type, of course, should be a clinical based paper. Of course, here or there, one or two, a few one-liners will be there, but the major chunk will be formed by clinical based paper. Now, very often student ask me that sir, whether image-based questions will be there. And history, very recent history has shown us that image-based questions, they do form an important part. Why? Because when you include an image in the question, the examiner gets the opportunity to test the student holistically. He can give you the image of a clinical sign. He can give you the image of, say the image of retina dense deposit disease, ask you about optic drusen. He could give you the image of angiokeratoma and Fabry's disease and ask you related question. So very similar to if anybody has taken the MRCP exam or the USMLE exam. So our Indian exams are not totally directed towards them, but yeah, it is gradually shifting gears. So image based, please do expect. Now source. Now as I told you, all the 150 questions will be of your postgraduate exit level questions. Now you all know that your postgraduate book of medicine, which is your Bible, your Quran, your Bhagavad Gita, your Guru Granth Sahib, you all know is your Harrison's textbook of internal medicine. So definitely Harrison will form a major chunk. But sir, I so often get this query, sir, will each and every question be from Harrison? My answer is no, a strict no. Why do you say so, sir? Just to cite a very similar example, while you were preparing, or while many of you are preparing for your MD or DNB medicine finals, is it only the Harrison that you read? Don't you read any other source for specific questions? Don't you open Braunwald for a specific topic of arrhythmia? Don't you open Bradley for a specific topic of stroke? Don't you open Fihali for a specific glomerular disorder? Don't you often open up to date for specific management of ITP or so? You do, right? Because Harrison, definitely, it is probably the best book around. It has a lot, but of course, it has its limitations. It could not incorporate everything in the super specialty. Of course, otherwise the super specialty books wouldn't have been there at all. So that is why, but at this point, I would like to tell you that Harrison does mention almost 90-95% of everything. For example, just to cite an example, it has the mention of peritoneal dialysis. It has the mention of fibromuscular dysplasia. It has the mention of, say, a topic, say, renal transplantation. But renal transplantation, even reading an entire book on renal transplantation wouldn't suffice. So if a question would be asked on, say, a CMV nephropathy in a renal transplant patient, would you say it is out of Harrison? Why, sir? Because it is there mentioned in Harrison about CMV nephropathy. But sir, is everything about CMV nephropathy mentioned in Harrison? Of course, the answer is no. So that is why to score a cream rank, to score a rank within the top 50 or the top 100, only reading Harrison will not be enough. And that is where we come into play. I come into play, our team comes into play, where we will give you do not have to hunt for various sources. You do not have to go and hunt for Braunwards, for Fialis, for Brenners, for Adams, for Schlesingers. No. You just have a one-stop solution. You can come to us and we will offer you everything extra in a very simple, crisp and concise manner. As I told you, everything will be taken care of. That too very, very systematically if you come to us, and we will be engaging in an interactive mode of learning. It will obviously not be a monologue. So, at this point in time, does anyone have any doubt with regard to the pattern of the exam or anything? I'll just wait for 15 seconds or so. So, you can type your questions in the chat box. Is there any question that you have? Please, you are very, very, you can be absolutely free to ask me anything you like. Anything. Please tell me if you have any question whatsoever. Just a very, very important thing that I've just realized, that this video is only available on the subscriber only mode. So, you have to subscribe to the Doc Tutorials YouTube channel. Only then can you view this video. Please do so. And you are very, very open. You are very, very, you can very easily ask me any question by typing in the chat box, if if you are willing to do so. So Dr. Siddharth has asked me, among 150 questions, will Nephro cover 20 to 25 questions? See, what I just told you is that nephrology, along with cardiology, neurology, and gastroenterology, see, these will form the major chunk of questions. So, if I think that these four have to form 100 questions out of the 150, of course I expect that 20 to 25 questions will be from nephrology. Absolutely correct. They will be from nephrology. And rest of the subjects like rheumatology, endocrinology, oncology, and infectious diseases will be there for the next 50 to 60 questions. So definitely you can expect 20 questions out of nephrology, beyond a doubt. Of course, a few questions will be overlapping, and it will have components of various subjects. For example, say an ECG of hyperkalemia. Now that will have a component of cardiology as well. That will have a component of nephrology as well. So for example, electrolytes, they are obviously overlapping between cardiology, endocrinology, and nephrology. Yes, you can expect 20 questions at least in your NEET SS out of nephrology. Yeah. So what is the success mantra? Sir, you have stated the problem statement. Now, can you please help us in making our lives easier? Already it is baffled by so much. Some of us are in medicine residency already. It's a final year, we have our exams around the corner. Some of us have our personal problems. We are married, we have kids, maybe we may be doing a bond posting, we may be in our remote locations. We don't have access to much. Yes, I know it all, and I have been through it all. I am just like your elder brother, always available, just a text message away. So my success mantra, if I were in your position, I never dictate to my students, to my juniors, that this is to be done. Obviously, each one of you has to carve a path of your own. What I can tell you is, if I were in your situation, what would I have done? And what I have already done in my recent past life to be sitting here across the table with you. First and foremost, start early. This is the golden rule right from our even MBBS entrance examination. We always know that those of us who started early, right at the beginning of class 11 or so, and we started for preparing for the AIPMT, which was called in our days, now it's called by some other examination. So maybe NEET UG, those who started early, they have the advantage. They have the advantage of what? Initial days can be confusing as to how to approach. They have that advantage. They can afford to get confused. They can afford to fail, and they can afford to rise. Next, please do not procrastinate. Now, this is, I think, I always say, to not only for an exam, even in life, if you need to be successful, procrastination is the biggest enemy ever that will not let you achieve something, or that has already not let you achieve something, or even me for that matter. Because winners never procrastinate. We should always take up the job at hand and be right at it. And please remember, persistence is the key, and you need to have a persistent effort. If you want to lose weight, if you run 100 kilometers a day, you will not lose weight. Maybe you will end up in rhabdomyolysis and end up with an acute tubular necrosis leading to acute kidney injury. But if you run 1 kilometer a day for 100 days, that is when you will lose weight. So it has to be a small, graded, structured approach, which has to be persistent over the days. So right now, you should be making is, you should be making a plan for yourself. Around 4 months are there, so you have 120 days at hand. So you should be making, say, a 90 days plan or a 100 days plan, for that matter. Try to finish everything. Try to make notes of everything, and the last 30 days will be the game changer, will be the last lap of the race where you will pull the fifth gear. I just remember, I'm just getting the glimpse of my favorite Jo Jeeta Hai Wahi Sikandar race, where Amir Khan, in the last 200 meters, he pulls the fifth gear and he gets ahead of the villain in the movie. And that is my favorite movie ever. That is why I say always follow a structured approach. You know, in residency, what do we do is today I saw a patient of vaginous granulomatosis, now known as CGPA. I will read about CGPA. Next day I saw a patient of mitral stenosis. I will read mitral stenosis. That is how we do, and we should do also. But for any entrance exam, just remember your NEET PG days. How did you prepare for it? What did you do for it? You had 19 subjects to study. If you would have been reading randomly, you would have not landed up here. The fact that you have landed up here and you're preparing for NEET SS means that you're already a winner and above. So just stick to your old rules, because old is gold, as they say. Just have a structured approach. Just, build a plan, and we are here to help you build even that. We will give you a plan, but just stick to it. Just follow it arduously and religiously. Be with us and we will take you across the line. And that is a promise from your elder brother. That is a promise from my side. Now, targeted study. Now, please remember, this is not an exam where you need to cover the depth of every topic. You need not know everything about every topic. No, you need to cover the breadth of the subject as well. You are not dealing with one subject. Actually, it is amalgamation of nephrology, neurology, cardiology, hepatology, gastroenterology, oncology, hematology, rheumatology, and pulmonology, and everything else. So please do not undermine the importance of this subject. If you sit with the super specialty books of each of the specialty in your table, trust me, your table will break. This is the amount of books that are available, and they are necessary also. But it is not an exit exam, it's an entry exam. You need not to know everything, but you need to know the important stuff and the conceptual stuff. Okay, so be smart. Don't study everything. So here is also where we come into play. We shall tell you with our experience that how much to study a topic and where to study it from. Or we might even provide you the materials. We'll spoon feed you at times and tell you कि बेटा इतना ही पढ़ना है. Don't study more than this. Next, take exams regularly. Now, I always tell you, as our hormonal systems, and in fact, most of our systems in our body work on a feedback mechanism, feedback regulation. I feel feedback is the biggest system that helps you to grow in life, not only to clear an exam. If you do good, it boosts you. It helps you to maintain your position. It will tell you, no, I cannot lose my position. If you do bad, it hurts your ego. At least it does to my ego. I really get hurt. And the next time I come back with a bang. So we at Doc Tutorials, we take exams, we conduct exams every week with a targeted syllabus that you have before in hand. So when you take that exam, you get a rank, and that rank is a national rank. So when you get that rank and you are in the top 3 or the top 5, that will definitely boost your confidence. And if you don't do well, as I told you, you should buck up. That you will be astonished to know, and you'll be happy to know that all the top 10 rankers in the nephrology elite tests last year, in the grand tests last year, have been in the top 10 this year also in the INISS and the NEET SS. So is it just a mere coincidence? It could have been for one student, but of course not for all the students. So that is the power of consistency. They have themselves told me, you can go and read, and you can go and view the videos, the testimonial videos, and the appraisal videos that we had with them, where we were asking about their journeys, and all of them have told me that, sir, this exam strategy and ranking strategy helped us a lot. Last but not the least, revision is the key. The one who reads newer things till the last day will not succeed. The one who has completed most of it at least 15-20 days before and has done a couple of revisions before the exam, he is bound to be successful in the exam. He is bound to be successful. So you have to revise. And to revise such a huge subject, you should have a consolidated matter pool. For that, you should watch our videos, you should make notes of it, and then your own handwritten notes, trust me, they are gold dust. I have still stuck to the age old rule of, you have, all of you have iPads, all of you have various technologies. But trust me, I am still old fashioned. If you have your own handwritten notes, it could be on OneNote or it could be on a pen and paper. Trust me, no comparison, no substitute. So, sir, how do we do this? You have given us a solution also, but sir, please lead us through the path. So here we are. We have already begun with the NEET SS Elite Session 2 schedule for the medical group. Now, we have already begun with weekly tests spanning across all the specialties of medicine. And on the 2nd and 9th of Feb, neurology has already been conducted and we have got amazing feedback. On the 16th of Feb, you are going to have the cardiology. So we have divided the major subjects into two portions, and you already get the syllabus of part 1 and part 2 beforehand. So similarly, you have on the 2nd and 9th of March, part 1 and part 2 of nephrology. The syllabuses of which I have already released, and I'll tell you once again. So that once you are done on the 23rd of Feb with cardiology, what will you do? From the 24th of February 2022, you will sit down and start studying for nephrology part 1. What you will do? The ideal approach should be, you should go through my videos. You should go through my videos, make notes if you haven't already, and revise them. Also, study our question bank and then sit for our exam. Once you sit for our exam, I will make sure that I will cover the length and breadth of each topic that I have given you to study. And then on a video discussion, live video discussion, I will give you the explanations of the answers and solve all your doubts, if any. Also, I will give you some extra brownie points which will help you clear any exam whatsoever. Trust me on that. Similarly, you will be having exams on gastroenterology, hepatology, oncology, and in April and May you will have exams on pulmonology, hematology, endocrinology, rheumatology, and infectious diseases. So this is very important. Now again, if you ask me, sir, what will the exam be based on? Of course, you cannot undermine the importance of this book. You cannot undermine. This is the golden book, undoubtedly. But sir, will it only be on this? Of course not. As I told you, you have the latest guidelines. You have a lot of things which are not covered, especially the management of glomerular diseases. They have absolutely evolved over time. Very many concepts have evolved over time. Very many investigations have been renamed. Diseases have been renamed. Because Harrison's was written, say, 4-5 years earlier. Of course, that is not valid in today's context. That is why you have an extra edge if you are associated with us, and you get to know everything. The latest till the day before will be there at your dispersal. Now, as I told you, I have divided the entire nephrology into part 1 and part 2. This will be conducted on the 2nd of March, and this will be on the 9th of March. So on the first elite test of nephrology part 1, you will have the topics which will be the basics, the urine examination, which is absolutely gold. It's it's given bits and pieces in Harrison's, but very, very important. If you've seen my video, I have taken a 20-30 minute video on urine examination, and each and every word that I've told you is very, very important. You will have the AKI, CKD, renovascular diseases, pregnancy and kidney. Now, for example, this topic is not separately mentioned in Harrison's, but you do get questions on pregnancy and TMA. You do get questions on preeclampsia. In fact, on preeclampsia and kidney injury, you've been having questions, at least 1 to 2 questions each year, but it's given in one single paragraph in Harrison's. Of course, that won't suffice. Now, hemodialysis and PD. Trust me, what Harrison's has done is it has touched upon every topic. it includes a mention of KT by V. It includes a mention of urea reduction ratio. It includes a mention of CRRT, SLED. But does it explain you everything? No, not at all. Anyone who's read Harrison, if I ask him even basic question about transplant, he will not be able to do so. Why? Because the concepts are, it is not its fault. It could not incorporate everything. That is why we will discuss everything in details. Next is the glomerular diseases, which is of course the thalaiva or the pushpa in today's context of nephrology. It always has been and will be comprising the major chunk of nephrology questions. Of course, you have the tubulointerstitial diseases, diabetic nephropathy, hypertensive nephropathy, cystic and congenital diseases. Don't at all consider it minor, because it is though a minor chapter, very high yielding, lot of minute MCQs, genes, translocations, chromosomes, subtle questions are asked. And electrolytes, my favorite and perhaps the very most enigmatic topic to most students. It is very, very important. Acid base balance, the metabolic acidosis, high anion gap metabolic acidosis, urine anion gap, urine osmolar gap, and everything is very, very important. Coming to nephrolithiasis, nephrolithiasis, again, you might say that it's a urological topic. You are true, but certain aspects of it, I mean, which vitamin causes stones, or for example, which is a radiopaque stone, which is a radiolucent stone, which is the drugs causing stones. And even in this NEET SS, you had a question on chronic urinary tract obstruction. So this also is very important, and it is already there as a chapter in your Harrison's. But what I shall do is, I shall curate questions. I shall pick up those lines from Harrison's which perhaps your eye will not consider that important, and you might miss. That is why I say that such guided approach will help you. Now, as I told you, this book is the Gita, the Quran, the Bible, the Guru Granth Sahib, and everything. Every holy book, you can call it absolutely as per your convenience. Now, coming to nephrology, you all know that Harrison has part 1 and part 2. Part 1, of course, is very, very important. Very many students say that, sir, is it important? Yes, it has the clinical symptomatology and its correlations. Coming to nephrology, it has basically 5 chapters. You have the dysuria, azotemia, urinary abnormalities, fluid electrolytes, calcium disorders, and acid base. All 5 are very, very important. Now, just I can recall that when I was an MD student, when I was studying my MD, I used to have problem in topic of renal tubular acidosis, because it is not separately given here. But you all know, even from your NEET PG days, even from your All India Postgraduate Entrance Examination days, that RTA has been a very favorite topic of examiners. Because if you can easily recall those questions, that hyperkalemic RTA is seen in type 4, stone forming RTA is type 1, Fanconi syndrome is in type 2. But of course, these are not properly given in Harrison's. So does it mean it will not come? Of course it will come. In fact, if you have to ask me one high yielding topic of nephrology that is asked over and over and over again, it has to be RTA. It has to be RTA. That is why you have to read page by page, word by word from Harrison's, at least, the section 7 for nephrology. And so too, of course, for all other subjects. Coming to the part, the second book of Harrison's, where you have the kidney and urinary tract in the part 9. And you have approximately, 11 chapters encompassing nephrology, where you have the cellular and molecular biology of kidney, where if you clearly see, very many students say that, sir, if it is Harrison based, why will I be asked anatomy? Why will I be asked physiology and embryology? But beta, if you clearly read it, you will be astonished to know that all the 3 basics part, embryo, anat, and physio, have been covered at this chapter. It is so important. Okay, then you have the AKI. Now, coming to AKI, of course, again, a very novel and important topic these days is the novel biomarkers. But sir, they have been just mentioned names of in Harrison's, but they are very important. You know, the TIM2 and IJBP7, you know, the interleukin 18, the cystatin C, the KIM1, all are very important. Coming to CKD, CKD is again very important, especially the mineral bone disorder, especially the anemia part. Now, coming to anemia, now see, anemia, it has just been there in a small paragraph. But the recent concepts of anemia, the KDIGO guidelines, the newer drugs, the roxadustat, the daprodustat, the PHI inhibitors, they are so important. You have to study them, which of course, I am there to help you in. Then you have the dialysis. You have a different chapter known as dialysis. You have a different chapter known as transplantation. And of course, the glomerular diseases, the thaliva or the pushpa as you all call it. Very important. But the management part is absolutely outdated. It is absolutely not going to work if you study the management part from here. You have to study the management with me, because I will be teaching you the latest guidelines, the 2021 guidelines, which absolutely are the need of the hour. Then you of course have the tubular interstitial disease, the polycystic disease, the vascular injury to the kidney, and as I told you, the nephrolithiasis and urinary tract obstruction. So of course, you need to go through every page of this book to at least to be sitting in the exam. Even after that, you will not be able to answer each and every question. Now, the golden question. You know, even after repeating this nth time, I know still I will get a lot of messages in my mail and my WhatsApp stating that, sir, will Harrison suffice? As I told you, if you know, out of the 100% questions of nephrology, what I am trying to tell you is approximately 60% will be direct from Harrison's. 10 to 20% questions will be indirectly from Harrison's. And approximately 20% questions will be out of Harrison's. You know, this is my prediction. What do I mean by that? What I mean is, most common glomerular disease in the world, direct one-liner. Or for that matter, the nephrogenic strains of streptococcus are all except direct from Harrison, which it is included here. Now, indirect, say urinary Hoffen is seen in which opportunistic infection after renal transplantation? Answer is BK virus nephropathy. So BK virus nephropathy, is it mentioned in Harrison? Yes. Is urinary Hoffen mentioned? No. So it is basically indirectly mentioned in Harrison. It is there also, but it is not there also. Say about renal tubular acidosis. Urine osmolar gap. What is the urine osmolar gap in RTA? Is UOG mentioned? Yes. Is RTA mentioned? Yes. Is a detail mentioned? No. So it is there also, but maybe it is there, but not there. So it is an indirect question from Harrison. But, sir, will everything not be directly or indirectly from Harrison? No, sir. There will be certain portions which maybe you have never even heard of if you are only reading Harrison's. Say maybe if it asks you, say a Steele syndrome in AV fistula. It's a very basic nephrology question. But of course it is not mentioned in Harrison. But as a nephrology aspirant, if you ought to be, studying nephrology, if you ought to be worthy enough to be getting a nephrology seat, are you not supposed to know the basic thing? Maybe say a rule of 6 in AV fistula. It's a very basic and easy question. But yes, you ought to be knowing this. That is what will be out of Harrison. Or maybe say the first line drug for a frequently relapsing nephrotic syndrome. Maybe the first line drug for a steroid resistant nephrotic syndrome. When do we do a genetic testing in a nephrotic syndrome? All these questions, they are not there, but they are there in the latest guidelines. They are there in the latest updates which come so regularly and so often. So that is where we come into play, and we will help you crack this 30 to 40% mark, and this will differentiate you from the rest of the world. And that is why I always say, you are the doc tutorial students, and here you have the rest of the world. And trust me, if you're there with us, we will leave no stone unturned to help you sail across and take you to great places. Now, students come and tell me, sir, should I read Fihali's Comprehensive Clinical Nephrology? Should I read Brenner's and Rector's Kidney? Should I read Danovich's Transplantation? Should I read Dogrida's Dialysis books? This is what some of my seniors have told me. What I do is just laugh, and I just, I just want to tell them that, beta, please, please and please tell your senior to keep his hand on his heart and ask him, did he himself study all these books? Is it humanly possible to study during your MD or DNB residency days all these books? My answer is no. Even I did not study. But I did have to go through some important points out of these books, with reference to the previous papers and stuff like that. But you are so blessed that you have doc tutorials teams with you, because you need not open any of these books. And I can vouch from, not only from my side, but also from the entire team, for any specialty, you don't have to open the book, because we are there to provide you all the extra material, all the tables, all the guidelines that you may require from these books, so that you have everything concise at one place. Similarly, what you don't ask me is, sir, KDIGO guidelines, very, very important. You have the KDOKI guidelines, very, very important. These are in fact more important than cramming old notes in old books, because these are the updated information. And this is what the examiner wants you to know or asks you about. And that is where we will come into play. And trust me, I can vouch it, I can write it on a paper and give it to you, that you yourself have no requirement to open all these sources separately. We are there, we will take down the important from each place and give it to you in a collated fashion. That is why we say, मैं हूं ना, actually I should say, हम हैं ना. Because we are there as a team, and we will help you to, jot down everything at one place. Because, speaking about me personally, I have recorded the nephrology video in say 45 to 50 hours. So in those 45 to 50 hours, if you study my nephrology videos, if you make down notes, you will have each and everything. Trust me when I say that, even for your DM or DNB nephrology, later on, it will come into play. It will be damn useful to you, because such is the flow of my flowcharts and mind maps and algorithms that will help you. So as I was saying time and again, what is the edge if you're associated with us? Of course, we have a wow team. When I say wow team, we have stalwarts. We have Dr. Kamal Sharma sir, who is a very internationally renowned person in cardiology. We have Dr. Rahul Rajiv, who has done wonders for neurology. There is me in nephrology. We have Dr. Prashant in gastroenterology. We have amazing faculties in oncology. We are joined by newer faculties in endocrinology, Dr. Niaz in infectious disease, and so on. So it's absolutely a wow team. Even I am awestruck by our team. So that is why I say that. We have rich, updated, recorded, crisp videos. I could not add more adjectives, otherwise I would have added it. Because they are definitely recorded and ever updated. Even yesterday, if I get an update about a hyponatremia, a newer drug that has come to the market, I make it sure that I get it updated in my video. So that is the level of updation that I'm trying to do for my students. Next, flowcharts. See, every information is there in the market. Every information is there in the book. So is it possible to go and read everything? Of course not. It is my role as a teacher, as a mentor for you, especially in an entrance exam, that I give you not only what is needed, but also I should tell you what is not needed and to eradicate that. And I should give you in such a manner that you should retain it. That is why I always teach every topic in a way of flowcharts and mind maps. I try to compare 3-4 topics simultaneously so that मेहनत होगी एक की output होगे 3 times. That is how I study. That is how also I make you study. And integrated approach. You know, we have an integrated approach. There could be certain topics that, maybe say a uremic encephalopathy, maybe say an infectious disease that has hit both maybe say a cardiorenal syndrome. So where, both of me and maybe and Rahul Rajiv sir, maybe me and Kamal Sharma sir may come together on a live video and discuss with you. Because integrated approach is a need of the hour. Not only for the exam, also when you see a patient, you don't see a neurology patient separately. You don't see a nephrology patient separately. My patient who's a patient of AKI has encephalopathy also, has heart failure also, he may have a pericardial rub also. So I need to be holistic in diagnosing each and everything. That is why an integrated approach is what we promote and what we practice. Then updated question bank. This is what I'm very proud of. Most of the existing question banks in the market, be it in text, be it in other apps, they are old and outdated. They have taken down questions from old rotten question banks, taken it down there. They've not even cared to update the answers. But we have handpicked the questions from the latest guidelines, latest textbooks, and have corrected the answers ourselves along with valid explanations and valid references. So, time and again, we've got a pat on our back by our students, and I'm really proud to say so that our question bank is fantabulous with the least amount of errors. I wouldn't say devoid of errors because we all are full of errors as human beings. So there might still be some errors, but I think it is the least. Weekly test, I've told you enough about. Live sessions. Now, see, when you interact on a live interface, of course, this is a virtual day. This is a this is a day of virtual age. So, but when you interact live, if I can see your face across the screen, if we can have an eye contact, you can ask me, sir, or anything if you want to ask me. That creates another level of understanding. So I am always there available. Very many students even call me from the wards that, sir, this is my patient, this is the urine output. Sir, iske urine mein ye aaya, what should I do next? One of my students, you would be surprised to know, was working in a remote place doing his bond posting, and he suddenly, he got a snake bite induced ATN, and he called me literally that, sir, this is the case and I'm seeing it for the first time. How do I manage? And I literally, held his hand through and tried to help him to my maximum ability. So live session will be there after tests also, and otherwise also. Any topic if you want, sir, come live and explain it to me. I will do my level best to do so. Next, the game changer, or as my students say that, sir, this is the biggest help. Not only the academic help, but also mental, psychological support is the WhatsApp group and other social media support. Now, I would like to tell you that all of us faculties have separate and integrated WhatsApp groups where we have the aspirants. We post updates, they ask us questions. Even, even students DM us separately and ask us any random question. And even in the night, in the morning, or any time when we are free, we try to answer them. Many often it happens that I don't know the answer, and I'm happily ready to admit that. Then maybe, I even go and look up the text. I look up references. I even have to ask my teachers some, silly doubts. Some students ask me, because I always feel that silly doubts are the most intelligent doubts. So, it clears my concept also. And I'm absolutely not ashamed to tell you that, because I don't feel that everybody should know everything, not at all. In fact, the person who knows that he does not know, I think he is a better person. So we are always there. That is why I say personal mentorship. Very many of our students were facing even personal problems. So, to whatever limited capacity in our extent, we did try to help them. We did try to motivate them before the exam, and they have cleared the exam. And now, even if I have started a movement of hashtag exam ke baad bhi, because all the toppers of a NEET SS and INI SS, I want to stay connected to them. So, I've made a separate group for them where, so that our nephrology, end of the day, everything leaving aside, it is a love of medicine. And in our field, it's a love of nephrology. So I really want to, spread the love of nephrology across the nation, across the world. I want to, I want to state maybe 10, 15, 20 years later, when one of our students, one of our, aspirants will be doing great. He will form a great guideline. Then I can say at least that yeah, he was there with us. So I want to stay connected with each of you. Even there, I try to post guidelines which is suitable for them. Maybe I learn from them, they learn from me, and it is absolutely a symbiotic mutual relationship that I want to, endorse. A very famous quotation, my favorite, which I have, enlarged and embossed and kept it in my study table. If you don't sacrifice for what you want becomes the sacrifice. And of course, as your elder brother, as your friend, I wouldn't want you to become the sacrifice. So please, please, and please, it is just a few months left. See, this is the exam. I know many of you might be saying, sir, हम तो ये काफी time से सुन रहे हैं. But maybe for the last time probably in your life. This is the exam which will decide what you will do for the rest of your life. Say, I don't want a person who was, aspiring neurology to land up in nephrology or endocrinology. Because, passion is what drives you. Because 5 years later, if you're not passionate on every Monday 8 a.m. to go to work, then, the entire purpose fails. Then you just become a mechanical machine and, you're moving here and there like a robot. But I don't want you to be that. I want you to be so passionate and enthusiastic that even at 1 a.m. you get a call from a patient and you are there up in a whisker. That can only happen if you get what you're passionate about. Don't compromise in life. I really don't believe in compromising, so I will not even tell you to compromise. Just sacrifice and you will never have to compromise. Last but not the least, what I would tell you is मैं झुकेगा नहीं. So we should never jukofy and we should be there together. I am always available there for you. I will just give you my contact details. This is my WhatsApp number. This is my email ID. Most of you are already there in my WhatsApp group. If you're not there, please join in. This is my WhatsApp number. You can personally text me. I'll add you in the group. But be there. Take the tests. See the videos. We have a lot of, we have a medical group package. We have the INISS package and we have the combo package. In the medical group package, you have the entire medicine and a few hand-picked videos of mine in the medical package. In the INISS package, you have the total medicine package and you have the total nephrology videos which cover in depth of nephrology, which will be definitely required to clear any INISS exam. And last but not the least, the combo which has both of them. Now for INISS, many students were asking me. I will cover INISS in great details later on, but just to touch upon it, INISS is a 2-stage exam. 60% will be nephrology, 40% will be internal medicine. Now the 60 nephrology, trust me, it will be tough. It will be tough and you've got to study. You've got to study my nephrology videos separately. I'm so sorry. This is, I told you about the recent NEET SS. No, this will not be the case. It will be very, hardcore nephrology based. This is not the breakdown. I will share with you and I will come again with another orientation where you have the part 1, which is the theory exam, which you clear it, and then you get a combined rank and you get an AIMS separate rank, and then at last you get go for the AIMS interview, those who qualify, and we will even conduct a mock interview there, and you can hear it from all your students and from all your seniors how they fared well. And most of our students cleared the interview also. We have 4 rankers, 4 in top 10 of NEET SS. We have rank 1 in AIMS, rank 3 in we have 1 student studying in AIMS Delhi this year who scored rank 1 in PGI Chandigarh, 1 in JIPMER. So absolutely great results by students. So with this, I am open to doubts if any. I'll just wait for 5 to 10 seconds. If anyone has any doubt, You are very open to ask me. Please ask me any doubt in your chat box if you have any. If you don't have it now, you can later text it to me as well. Does anyone have any doubt